Hi everybody, Dr. Carly from Wave of Life Chiropractic. Today we're going to be reviewing a case study of a male patient in their 40s who is dealing with migraines and shoulder pain. Let's pull up their initial scans so we can dive into exactly what they were dealing with. This is our patient's heart rate variability. It shows us how balanced the autonomic nervous system is. The autonomic nervous system is part of the nervous system that automatically functions. And when there is stress on the nervous system and it's not regulating properly, we can see it in heart rate variability scores. Heart rate variability scores are very common to measure. This one measures and shows us where there's fatigue and stress compared to your Apple Watch or your Fitbit or those Garmins that monitor heart rate variability while you're sleeping and showing your optimal score. This is showing us how your score is functioning and how you are dealing with stress and adapt to stress. So you can see at the top there, it shows adaptability reserve. Oh, my finger disappears. So your adaptability reserve tells us how well you can handle when something stressful comes into your environment. Your nervous system is naturally made to adapt to stressors that come into our environment. That's when cortisol gets released. That's when our blood pressure gets raised, glucose gets released, so that we can either decide that we're going to fight this stressor or we're going to run from this stressor. Now, common days of having these stressors, common stressors are no longer as life-threatening as they used to be. They are emails, they are deadlines, they are overstimulation, they're the one more thing that you are adding to your to-do list, one activity after another, a packed schedule. This stresses the nervous system out, but the nervous system can't determine if it's life-threatening or not, and it still sends the same responses if it were life-threatening. So we have chronic fatigue because our cortisol is through the roof all the time. We have muscle aches because of the blood in the muscles and the glucose causing the muscles needing to be overworked, but they're not worked because we're sitting all day. So when we're looking at our heart rate variability in our office, we're looking at how well you adapt to the stress in your life. So you can see his heart rate variability is down in the lower yellow space, almost to that orange zone, telling us that when he is stressed, it plummets even further. So our patients are sitting in a relaxed state in our office. There isn't anything that should be stressing them out. We don't wear white coats, so we shouldn't have white coat syndrome. And they're in a calm, safe space. Now, it's very common that we see that this white dot is not in the green zone like we like it to be. We want it to be up in the green zone there. That'll tell us that we have a high adaptability for the stressors in our environment. Let's look at what his scan does in just 8 weeks, 2 months of care, that he was receiving regular adjustments at 3 times a week, changing how the bones were positioned, and see how that impacted his heart rate variability. All right, so we can see just in 2 months of care from March 10th to May 12th, we have a beautiful white dot right in the green zone here. That is showing us some really nice adaptability within the nervous system, and he's better able to handle the stressors in his life. So I like to talk to my patients about how this is not about changing the stressors that are in your life. We can't just find a new job, get out of the toxic job. We can't find a new way from work. But what we can do is regulate the nervous system. We can get adjusted to help balance the nervous system and impact how the nervous system is responding to the stressors coming into our environment and allow our body to adapt more efficiently. Next, we're gonna look at his muscle tension scans, really showing how those achy shoulders, achy upper back, and those migraines were affected by that muscle tension. Okay, so we can see the muscle tension on this patient's body. Red is severe muscle tension, blue is moderate, green is mild, and white is a measurement of a normal reading. Now, look at the static EMG, especially around C5, T2, and L1. He has a reading of 54. His body was in total compensation mode. You can really see that upper cervical and thoracic tension when your neck and upper back are chronically tight. It affects the blood flow and nerve function to the head. The migraines weren't random. They were his body's way of saying something was wrong. So let's look at and see how his scans improved after just 2 months of care. Here is his scans after 2 months of care from March 10th to May 12th. You can see some amazing improvement there. We have moderate muscle tension at C5. We have mild muscle tension in the lower back. And it didn't happen overnight. Each adjustment built it on himself. He was coming 3 times a week for 2 months, allowing that chronic tension patterns to release and his nervous system to shift from survival mode to thrival mode. We are looking at how chronic aches and pains and regular migraines aren't just part of getting older. Your body is designed to feel good and perform well regardless of your age. So after seeing how this patient improved with his chronic back pain, achy shoulders, migraines for 2-3 times a week, and now he's able to have more energy at the end of the day. He's working more efficiently. He's back to working out and doing the things that he loves to do on a day-to-day basis. So we're really improving the quality of life through these regular adjustments. If you know anybody or you yourself are dealing with chronic pain that's affecting your workouts, your sleep, your quality of life, remember there's usually an underlying cause that can be addressed. And we can find out just through these simple, non-invasive scans that take 45 minutes for us to get a full understanding of your history, your exam results, and really know how we can help you and start helping you live a higher quality of life. So DM us any questions, comment below with any questions so we can start to really help you feel better and help our community live longer and have a better quality of life.